Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Assalamu alaikum. My name is Fazan Asteen and my roll number is BP1650071. My course number is PHP705 and I'm a student of 5th Professional Morning. My assignment is on rational and irrational use of drugs. And the drug that I have is calcium folinate. Introduction. Calcium folinate is also called as folinic acid or leucovorin. It is basically a medication which is used to decrease the toxic effect of methotrexate and pyrimethamine. Rational use or the main indication. Rational use means that when we should be giving the drug to the patient. So it is given to treat or to prevent serious cell disorders like thrombocytopenia, which is decreased in the platelet count, neutropenia, decreased in the neutrophil count, or anemia when we do not have enough RBCs, healthy RBCs to carry oxygen to the body tissues. It is caused, and these blood cell disorders are basically caused by certain drugs. Like folic acid antagonists such as methotrexate, trimethoprim, etc. It may also be used with certain cancer cells like cancer cell drugs like 5-fluorouracil to treat patients with colonic cancers. Leucovorin is also prescribed to treat certain types of anemia in which we have folic acid deficiency, and this type of anemia is the one in which we have a condition in which folic acid cannot be taken by mouth. The adverse effects which are associated with leucovorin is allergic reaction, in which we have rash, itching, and facial flushing. Facial flushing is when you have redness on your skin. Drug interaction. When folinic acid is given with 5-fluorouracil may increase the toxicity associated with 5-fluorouracil, and the adverse effects which can be faced by it are particular in elderly patients, and they include severe enterocolitis, diarrhea, and dehydration. When folinic acid is given with sulfamethoxazole and trimethoprim, it decreases its efficacy to treat the pneumocystis cerevisiae, which is a common type of pneumonia in AIDS patients. The irrational use of folinic acid, irrational use is when we are not using the medication according to the prescribed rules. So the irrational use of folinic acid is over prescribing. Folinic acid is an intermediate in the metabolism of folinic acid, and therefore this is considered as a natural agent. Large doses, when administered, have no apparent side effects. Such doses suggest that the administration of this drug is relatively safe. Signs of excessive dosing, if they occur, should be treated symptomatically. An excessive amount of folinic acid usually nullifies the chemotherapeutic effect of folic acid antagonists. Dose depending upon the condition, meaning that depending upon the disease, we are going to decide the dose. So we are going to give intramuscularly folinic acid if a person is suffering from folic acid deficient megaloblastic anemia, and the dose is up to 1 milligram per day. Intravenous we are going to give intravenous folinic acid is given if we are giving it as an adjunctive therapy in colorectal cancer, and the dose in adults is 200 milligrams per meter square BSA of slow IV injection over 3 minutes, followed by 370 milligrams per meter square 5-fluorouracil by IV injection. The treatment is given for 5 consecutive days and repeated at an interval of 28 days for 2 courses. Subsequently, you may repeat at 4 to 5 weekly intervals if the patient has recovered completely from the toxic effect of the prior treatment. If you're giving folic acid for methotrexate toxicity antidote, then the dose is 15 milligrams every 6 hours for 10 doses, starting 24 hours after the start of methotrexate infusion. And for oral folate deficiency megaloblastic anemia, 15 milligrams for adults daily is given. Now we have dose variation in population. In adults, 5 in other tablet injections and injection powders and injection solution are available. The tablets of 5, 10, 15 and 25 milligrams is available. Injection powders for reconstitution are available in a dose of 50, 100, 200, 350 and 500 milligrams, and injectable solutions of 10 milligrams per ml is available. In children, in children, tablets of 5, 10, 15 and 25 milligrams are available. Injectable powders for reconstitution of 50, 100, 200, 350 and 500 milligrams are available, and injectable solutions of 10 milligrams per ml is available. Alternative drug. An alternative of leucovorin or folinic acid is leucovorin, but it was found that from the clinical trials that it is not superior to the generic drug, but in fact it is more expensive. Maximum prescribing and minimum prescribing dose of folinic acid is as follows. The maximum prescribing dose in adults in the form of tablet is 25 and injection powder is 500 milligrams, and in children tablet is 25 and injectable powder is 500 milligrams. The minimum prescribing dose in adults for tablets is 5 milligrams, and for injectable powder is 50 milligrams, and for children in tablet form is 5 milligram and injectable powder is 50 milligram. The brand names with prices. The two brands which sell folinic acid in Pakistan are available as follows. The brand name is Quiniran and the manufacturer is Al Habib Pharmaceuticals, and the price with which he sells is 540, whereas leucovorin is the other brand name which is manufactured by Atco Pharmaceuticals from Atco Laboratory Limited, and its price is 654. Antidote. No such antidote of calcium folinate is available because it does not have a toxicity of its own, but it does enhance the enhance the toxic effects of 5-fluorouracil, especially in elderly patients. Case study of folinic acid. Case study is that the case is that we have a 48-year-old male with a 2-year history of plaque psoriasis affecting his liver and trunk was advised 5 milligrams of oral methotrexate 3 times a week. However, accidentally he ingested 3 tablets daily for each 5 milligrams for 4 days and a total dose of 60 milligrams. A week later, he was presented to the emergency department with nausea, vomiting, and painful skin erosions over the trunk and intertragenous areas. He developed yellowish discoloration of the urine, and along with low urine output 3 days back, he developed fever and cough and respiratory distress. On examination, his heart rate was 110 per minute, his BP was 136 by 54 mm of Hg, and his respiratory rate is 38 per minute. He was conscious and oriented at administration and admission. Body investigation revealed pancytopenia. Other investigation on the day. Bilateral diffuse infiltrates were seen on chest x-ray, were believed to be due to pneumonia as his echocardiography and lower limb Doppler were all within the normal limits. So, notes. Subject. Chief complaint with which he came to the hospital was nausea, vomiting, and painful skin erosions over the trunk and intertragenous areas. His age is 48 years. His gender is male, and his history is that he has been suffering for 2 years from plaque psoriasis, which has affected his trunk and limbs, for which he was prescribed to take 5 milligrams oral methotrexate 3 times a week. Object is his laboratory test shows that he has heart rate of 110 and his BP is 136 by 54 mm of Hg, and his respiratory rate is 38 per minute. Assessment. The patient accidentally ingested 3 tablets of 5 milligrams for 4 days and having a total dose of 60 milligrams, and he developed fever with cough and respiratory distress. His laboratory investigations revealed pancytopenia, and from all above mentioned data, it can be concluded that he has methotrexate toxicity. Plan. So we should immediately discontinue the use of methotrexate. And for supportive measures, we should be giving him folinic acid. We should give him urine alkalization, which is actually treatments given to increase the urine output. We should give him IV hydration, which is actually a sterile solution of NaCl in water. And we should give him GCSF, which is granulocyte colony stimulating factors. These are factors which actually increase the WBC count in the body. And we should give him drug products. Then these 7 are actually the references to the above assignment. Thank you very much. That is it.